Good morning, everybody. Today is 13 January 2021, and we are fortunate enough to tell you about the National Leprosy Control Program under the National Health Programs. I'm Dr. Nishi Prakash Jain, starting my presentation regarding the National Leprosy Control Program. As you know, the health programs are health promotion and the disease prevention programs focus on the keeping people healthy, and health promotion programs to engage the empower individuals and communities to choose the healthy behavior and make the changes that reduces the risk of developing chronic disease and the other morbidities. So this is the aim of our health programs. So as I told you, today is the 13th January 2021, and this year theme of the World Leprosy Day is Beat Leprosy and Stigma and Advocate for the Mental Well-being. So three words: beat leprosy, end stigma, and advocate for the mental well-being. I think this picture might be known to everyone, where the Lord Krishna is along with Ashwatthama. So Krishna intervened and revived the stillborn baby, and Ashwatthama was made to give up his source of power, the gemstone in the middle of his forehead. Due to his immortality, he was cursed to live forever till the end of time with the gaping wound and as ulcer with oozing blood and pus. So in our country, there is a stigma that most of the people who are having the oozing blood and pus of leprosy is is having the curse given by Lord Krishna. So such type of stigma we have to remove from our society, because this is important, because leprosy is not detected in the time and treated. It is a dreadful disease, causes the great to disability. So it must be important that it should be treated in early. So as you know, the leprosy is caused by the Mycobacterium leprae, a microorganism that has the predilection for the skin and nerves. And it affects the nerves, especially the Schwann cells, which is a glial cells, keeps the peripheral nerve fibers, both myelinated and non alive. So this word is important. Schwann cells are variety of the glial cells that keeps the peripheral nerves fibers alive. So if the Mycobacterium leprae is affect the Schwann cell, there are chances that the death of these nerve cells. There are some genetic determinants of the host response that the human genetic factor influences the acquisition of leprosy and the clinical course of the time. And the transmission is the two exit route of the M. leprae from the human body, often described as the skin and the nasal mucosa. There is a incubation time also, and that may last up to the 30 years. So very long time maybe for incubation of this leper. In our country, the National Leprosy Eradication Program (NLEP) is the centrally sponsored health scheme for Ministry of Health and Family Welfare, Government of India. While the NLEP strategies and plan are formulated centrally, the program is implemented by the state and union territories. The program is also supported by the WHO, ILEP, International Leprosy Eradication Program, and few other non-governmental organizations. So this is important because the international issue. There's some milestone in the NLEP. In 1955, the National Leprosy Control Program launched. In 1983, the National Leprosy Eradication Program is launched. Then there is a introduction of the multi-drug therapy, MDT, in 1983 only. Then 2005, the elimination of leprosy at the national level, and in 2012, the special action plan for 2009 high endemic districts in the 16 states and the UT they have taken. So they have focused on those districts where it is prevailing very high. They are having the objective, the early detection through the active surveillance by the trained health workers, a regular treatment of the causes by treating the multi-drug therapy at the fixed in the centers and in nearby village of the moderate to low endemic area, intensifies the health education and the public awareness program to remove the social stigma attached to the disease, appropriate medical rehabilitation and leprosy ulcer care services. So these are the objectives. And some component of program, the case detection and the management, disability prevention and the medical rehabilitation, IEC, information education and communication regarding regarding the leprosy, and the human resource and capacity building if somebody is having the leprosy, and program management. How one can eliminate the leprosy? So there are certain strategies for it. The decentralized integrated leprosy services through the general healthcare system, early detection and complete treatment of the new leprosy cases, carrying out the household contact survey to detection of the multivacillary and the child cases, early diagnosis and prompt MDT through the routine and the special effort, then involvement of the accredited social health work activist, that is ASHA, in the detection and the complete treatment of the leprosy cases for the leprosy work. Because these ASHA workers are directly related to the families. Strengthening and disability prevention and medical rehabilitation, information education system, for removal of the stigma. For further disease betterment, there are 4 institutes available for this training and research of the leprosy. These are situated in Tamil Nadu, Chhattisgarh, Orissa, and West Bengal. Under the NLEP activity, the diagnosis and treatment of the leprosy services, and from the dispensary only, it can be done. And in case of the difficult to diagnose, the complicated cases requiring the reconstruct surgery are referred to the district hospital. Training is essential part of this program. The training of the general health staff, the medical officer, medical workers, ASHA workers, and all these related to the development and the diagnosis of leprosy. IEC services and the disability prevention. These are the major function of the NLEP. Out of it, the supervision and monitoring is by the different level, analysis of monthly basis, new case detection and the treatment completion rate of the proportion of the grade 2 disability among the new cases is also a part of this. At last, as today is the Mother Day of Mahatma Gandhi, so according to this, his word, eliminating the leprosy is the only work I have not been able to complete in my lifetime. So it is now our duty that we should eradicate the leprosy from the country. Thank you.